For over 2 decades, the Canadian Centre for Refugee and Immigrant Healthcare has been the beacon of hope for newcomers who found it difficult, often impossible, to get the medical care they needed. Frequently changing rules and policy barriers confuse providers and newcomers, making it difficult to know who qualifies for medical care and who does not. Hundreds of thousands needing basic and urgent medical, dental, and psychosocial care are turned away. COVID-19 illuminated the vulnerabilities in our healthcare system. When we fail to provide care to everyone in our community, we provide care to no one. Recently published scientific reports demonstrate that immigrants, refugees, and other newcomers accounted for nearly 44% of Ontario's COVID-19 cases in the first half of this year. Immigrants and refugees who worked in healthcare, especially women, accounted for a disproportionate number of cases. Many immigrants and refugees face systemic inequalities that compound their risks: lower pay, socioeconomic inequalities, precarious employment, unstable housing, and ethno-racially based disparities and access inequalities. They serve us our morning coffee, stock our store shelves, and do the dirty and dangerous jobs that no one else will do. Waves of newcomers who wanted to make a better life for themselves and their families contributed their hard work and skills to building the Canada we have today. Many still find it difficult, however, to start again when illness and injury strike them or their family. Newcomers are among the most vulnerable people in Canadian society. At the Canadian Centre for Refugee and Immigrant Healthcare, our volunteer physicians, nurse practitioners, nurses, and other allied providers challenge the healthcare status quo and the very norms of a healthcare system that has not delivered access equity for Canada's most vulnerable persons. Each day, our volunteer teams and staff help provide free medical care to those who have fallen through the cracks in our healthcare system. Whether they are homeless, newcomers, temporary foreign migrants, we provide care without judgment to those in medical limbo. Healthy children are better able to play and learn. Healthy adults are able to contribute socially and economically to Canada's future. While COVID-19 forced the doors closed for many businesses and organizations, we took active measures to stay open and provide health care to anyone in the GTA. Our team set up phone lines to offer virtual care. We erected medical clinics and field tents to provide a safe environment outdoors for in-person care. Kids are receiving vaccinations again. Diabetics are receiving care. Temporary migrant workers with injuries are being treated. Your support makes all this possible. It propels our mission forward. Thanks to you, we are now in our 3rd decade of service. Our health providers inside borders wish you could witness the abundance of gratitude from our patients for the care they were able to receive through your support. Be assured that every bit of your support makes a difference and always will. 95% of all donations go directly to patient care. Donations help provide vital diagnostic tests, such as x-rays, ultrasounds, blood work, CT scans and MRIs, cancer care, medications, mental health care, dental chairs, and a food and warm clothing bank. We are Canada's foremost healthcare bank for refugees and immigrants. Just 1,000 Canadians donating $20 a month can keep the Refugee and Immigrant Healthcare Centre open for an entire year. Please think of them and our work during this season of hope and gifting. May you and your family have a blessed, safe, and peaceful holiday season in these difficult and uncertain times. Thank you.